again, thank you to everyone for tuning in. Share the live, share the live, share the live, because this is an opportunity for you to ask questions. This is an opportunity for you to get more information. I particularly want to focus on isolation versus quarantining and the do's and don'ts of those things. So that's what we're doing here today. Right, so let me go back a little bit to just clear up a couple points that people have been asking me about specifically. COVID-19, coronavirus disease 2019, COVID-19 for short, is the disease that you get, that some people get after they have been exposed to what is known as the SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2. That's the name of the virus. Everyone who comes into contact with SARS-CoV-2 does not necessarily get COVID-19. It's like any other virus. You know, there are some people who any fresh cold that pass, they get it, while there are some people who they could be mingling in the middle of everybody else who gets sick and then they don't get sick. That also happens with SARS-CoV-19, SARS-CoV-2, where everybody who comes into contact with SARS-CoV-2 does not necessarily get COVID-19. The thing about this particular disease though is that, or this particular virus, is that it seems like more people who come into contact with SARS-CoV-2 ultimately get COVID-19. So even though generally it's a normal thing that some get it and some don't, what we are recognizing is that for this particular virus, this particular version of the coronavirus, more people seem to be getting it when they come into contact with it. So you've come into contact with it and you get it and you get the disease. We are recognizing, and this is from looking at the studies, looking at the reports all over the world, that some people seem to have no symptoms whatsoever. So they have the virus inside of them, but they are not exhibiting the typical signs and symptoms, and I will talk about what that is just now. Some people have very mild signs and symptoms, very, 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 very mild. So it feels to them like they have a regular cold or a regular flu. And it means just staying at home for a little bit and recuperating, using your own traditional medication, or using things like the Panadol cold and flu and stuff like that. There are some people though who have a very severe response to it. Those are the people who we are most concerned about, because those are the people who go into respiratory failure. Because remember, it's a SARS, it's a severe acute respiratory syndrome. So those are the people who we have to get into the hospitals and who may need ventilators because they can't breathe. Okay? So I wanted to be very clear about that. The other thing I wanted us to be very clear about is the fact that when we have the symptoms, meaning because the virus is spread primarily through droplets meaning it needs to be inside of something. Okay, so the virus is inside the droplets, the things that the mouth water that come out of your mouth when you talk, or when you cough, that wet thing that comes out, or when you sneeze, the thing that comes out of your nose, the liquid that comes out of your nose. The virus is encapsulated in those droplets. And if you are next to someone who just sneezed, I mean, we've all experienced it. You feel the wet thing coming onto you. The virus is in those droplets. if you are close to somebody who just sneezed, then you get a direct splash into your face, and then the virus can go into your mouth, into your nose, into your eyes. Those are the pathways, and it then gets into your system. That is what happens. Those are the pathways. So if you happen to be that close to somebody and they sneeze and they cough and it gets on you, it flies in the air, gets on you, then you can get it that way. I've been seeing several people posting a WHO report that speaks about the virus being airborne, and I just wanted to clear that up a little bit. So far, it seems like the virus is mainly transmitted through those droplets. If you read that WHO report, though, it very clearly states that it can become quote-unquote airborne when we are doing procedures in the medical facilities that forces air into or out of the body, right? So we are talking about procedures, for example, like ventilating or putting a tube inside of somebody. You're intubating them. And because you are actually doing a procedure that forces the virus to come out of the droplets and can go into the air, then in situations like those, the virus is known as being airborne because it is now aerosolized and in the air. That is why the medical professionals, that's why medical professionals in particular, those who are in the room, those who are around when those kinds of aerosol generating procedures are being done, they need to wear the specialized mask known as the N95 mask, N95 respirators, because those masks are sealed. If you ever put on an N95 mask, you know it is very uncomfortable. Those masks are sealed onto your face. As a matter of fact, you need to be measured to ensure you are wearing the correct size mask. Those masks are sealed onto your face. It is not the regular cloth mask or the regular surgical mask. The surgical masks and so forth are there to protect you because those masks are designed to prevent the droplets from coming in. Or if you are sick, those masks are designed to prevent the droplets from going out and infecting others. Okay, so I just wanted to clear that up a little bit. We don't have any evidence right now. We don't have any evidence right now that shows that the virus is airborne generally in the general public, but particularly in medical situations, there is evidence that shows that depending on what you're doing with a patient with COVID-19, you can then, based on the particular procedure that you're doing, you can then have airborne SARS-CoV-2 virus. All right, so I just wanted to clear that up. I am particularly interested in issues pertaining to isolation and quarantining. And I say isolation and quarantining because those are two different things, okay? We need to be very clear. We need to be very conscious of when we say those words. And I think we've been getting some mixed messages because there are people who are giving messages, who are community leaders and so forth, who have been using those terms interchangeably, and that is actually causing a little bit of confusion in Tobago right now. So isolation is what happens when you have a sick patient. You have somebody who has the disease. We know that they have the disease. So isolation is what you do to separate those who have the disease from those who don't have the disease. Okay? You need to separate those who have the disease from those who don't have the disease. And that is what isolation is. In the truest sense of the words, our hospitals, for example, should have rooms that are completely blocked off, meaning the air circulation and so forth. Because remember I said before that depending on the kind of procedure you are doing with a COVID-19 patient, you may then aerosol or aerolize, what's the correct word? I can't remember what's the correct word, but you may then put the virus in the air. So the room that a patient who has COVID-19 needs to be in has to be a room that is completely blocked off from the other parts of the hospital, to ensure that even if the virus becomes airborne because of a aerosol creating procedure, that it is blocked off from the rest of the hospital. Okay, so those rooms, the way that is done, it is known as having, yes, Stephanie, negative pressure rooms, meaning we don't have mixing of air from that room into anywhere else. We don't have particularly we don't have any air coming from that room going into any other room. And that is what is absolutely necessary, particularly in a healthcare facility where you are treating with somebody who has COVID-19. So to be clear, isolation is what you do with a patient who has the disease, and you are trying to you are separating that patient from other people who don't have the disease. Aerosolized, yes, thank you, Zia. Oh gosh, yes. So that is critical to understand. So when we are talking about, so when you listen to people talking about having isolation rooms and so forth, that is the key thing you need to ask about. That is the key thing you need to be concerned about. Are those rooms really, really isolated from the rest of the hospital, from the rest of the facilities, from everything else and everyone else? The hospital outfitted with such rooms? As far as I am aware, I do not think we have any of those rooms in Tobago. So, which is why we need to ensure that we take all of the necessary precautions to not get this infection. As I said, I am not sure, but I don't think we have those rooms here. The ideal thing in a situation like this may actually be to designate an entire facility to treating with COVID-19 patients. So we know that the only people who are in the facility are COVID-19 patients, so we can, it is an isolation in that sense of the word. Okay, so let's go back to quarantining then. So remember we said isolation is when you separate sick people from those who are not sick, or those who don't have that particular disease. Because for example, if we're talking about sick people, if we're in a hospital, the other people in a hospital are sick, but they don't have those particular diseases. Okay, so that is isolation. Quarantining is if you have been exposed to the virus at any level, and you are now keeping yourself separated from other people who may not have been exposed to the virus. Okay, so let me say that again. You quarantine when you may have been exposed to the virus, and you are separating yourself from other people who have not been exposed to the virus. We need to be very clear with that. So for example, the situation with the 68 or how many of those people who came from the cruise, we know that there were cases of COVID-19 on the cruise. So the 60-something people who came off of that cruise, we know that they have been exposed to COVID-19, to other people with COVID-19. So we need to quarantine those people and keep them separate from other people who have not been exposed to other people with COVID-19. Now, quarantining can happen in two ways. Based on your level of risk, meaning based on how badly or how severely we thought you were exposed, we can then do one of two types of quarantining. We can have a state-instituted quarantine facility. So, for example, those people who came off of the cruise, they went into this, it's a Seventh-day Adventist campground, I think it is, called Balanta. I've never even heard of this before. This weekend, they went into Balanta. That is a state, because the state basically, in essence, took it over and identified this as a location where these people will be quarantined. So they are in a state-sponsored quarantine facility. That's one way to do quarantining. The other way to do quarantining, which is what they have also been doing based on your level of risk, is to do self-quarantining. Self-quarantining, okay? And what self-quarantining is telling you, and I understand that they have been having you sign a contract in essence, saying that you will adhere to the rules of the quarantine and allow you to go home so that you have they allow you to go home so that you can separate yourself in your home. So we have the state-sponsored where you go into a facility, but then we have the self-quarantine where they allow you to go home and keep yourself separated for the 14 days. Okay, so those are the two options that happens to people who have been exposed. And for example, if you, and I'm doing this now because there are several people in Trinidad and Tobago, because we have been cutting off our borders, the world has been cutting off borders and so forth. We need to be clear about what that self-quarantining is, because we have so many people who've come in on planes within the last couple of weeks. I personally know people who have come in on planes and they have been self-quarantining at home. So, and because we have more and more people doing that now, I thought it absolutely necessary to come and explain what that entails so that we are all on the same page, so that we don't say 2 weeks later, oh, nobody didn't tell me that I'm not supposed to do this, that, or the other, because it's critical that even if you are self-quarantining, you do it correctly. So let me go back to the one quick thing. I've said it before, but just in case this is new again, the reason that you are self-quarantining or state-sponsored quarantining for the 2 weeks, the 14 days, is because the incubation period for SARS-CoV-2, the virus that causes COVID-19, is 14 days. And what does the incubation period mean? This is the time, the average time, the normal time that it takes for somebody who has been exposed to start showing signs and symptoms. Okay, that is the normal time it takes. Some people start showing signs and symptoms within 3-4 days of being exposed. Some people go all the way up to 2 weeks after being exposed when they start showing signs and symptoms. And again, because it is at the point where you are showing signs and symptoms, or just at that point where you start showing signs and symptoms where you are infective, meaning that's when you start sneezing, you start coughing, and then you can, throw those droplets out into the world. That's why you have to separate yourself and to quarantine for that period to ensure that you are not out there infecting others. And that's the critical part. Quarantining is you, because you have been exposed, you are making sure that you do not then expose other people. That is why you quarantine. You are protecting other people. Now, let me highlight something that was spoken about in the media. There was a big hoopla about the group who came from on the cruise ship, that they had contacted a lawyer and blah, 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 blah. Now, one of the things I wanted to know is why they contacted the lawyer. And the lawyer claims, of course, we have not seen the letter or anything. The lawyer claims that one of the things that they were concerned about at Belanta or Balantra or whatever it's called is they were not able to practice social distancing even in the state-sanctioned institution, quarantining institution. Meaning, because of the setup of the institution, they were not able, according to them, to stay at least a meter, at least 3 feet away from another person. And that is also very critical for us to understand. Even in a state-sponsored quarantining facility, because everyone in that facility may not have been exposed at the same degree, or because we don't know who is sick or who is not sick just yet, you still need to keep yourself distant from other people in the state-sponsored facility. So it is not somewhere for you to go and lime with the other people. It is not somewhere for you to go and lime in a state-sponsored quarantine facility, because you don't know if the person you are liming with, who may not have any symptoms today, but tomorrow they have symptoms. And because you have been interacting with them so closely, you now in the state facility got sick. Now, you may not have been sick when you came off of the ship, but because you were interacting with other people in the state facility, you are now sick. And that is what we don't want. So even in the state-sponsored quarantine, you should still stay very, very far separate from other people. Please, please, please heed that warning. For those who are in self-quarantine, now the reality in other countries, because of the vast number of people who have gotten infected, the government does not have enough space to put everybody who may have been exposed. That's a reality. I hope in Trinidad and Tobago we never get to that point. I hope we never get to that point, but that is a reality. So the self-quarantining is something that you may have to do. And I do know that there are people who've come back from wherever they've come back from who are self-quarantining at home. So what does that mean? Self-quarantining at home, remember I said quarantining means you have been exposed and you do not want to expose others who were not exposed to the possibility of getting the virus. So that means if you are the only person, for example, who just came back from New York, you are the only person who just came back from New York and you are in your house, they allowed you to leave the airport and you are now in your house self-quarantining. It means even in your house, you should not be mingling with other people in your house. I really, really hope you understand that. Because even though you are self-quarantining, if you are mingling with other people inside your house, then you are also potentially infecting those other people who are in your house. And let's just think about it. Even though you are staying home and you are staying inside, those other people, because they are not under self-quarantine, may be leaving the house and going out and interacting with other people because they have to go to work or whatever. If you then interact with them, pass the virus onto them, they then go out to work because they have to. They can then pass the virus on to other people outside of your house. So you need, if you are self-quarantining at home, you need to be self-quarantining in a room by yourself. In a room by yourself. Ideally, you should be using your own bathroom if you have access to your own bathroom. Ideally, you should be using your own like utensils and so forth when you are eating and so forth for now. But you should not be mingling even with your other family members. You should not be mingling even with your other family members, at least not for the 14 days that you are under self-quarantine. Another thing that's important is because we are dealing with a disease that seems to be more severe in people who are older and more severe in people who have other comorbidities, meaning they have diabetes, lung disease, heart disease, any of those other diseases. Because those people are more at risk, so that if they contract it, they get sicker than others. If you are self-quarantining at home, ideally your elderly grandmother or your mother or whoever else who may have been living with you ideally should not even be in the same house. Ideally, they should not even be in the same house. If we are in a situation, if you are in a situation where there is nowhere else for them to go, or there is nowhere else for you to go, then ensure that you stay in your corner, and you stay in your corner for the 2 weeks. Because you don't want a situation where you come home, interact with your granny, and then she gets sick. Now, maybe you would only get a very mild case of it because of your age and your health, but granny is granny. Granny has heart disease, granny has diabetes, granny has breathing, granny has all kind of things already wrong with her. So if she gets it, she's not going to do as well as if you get it. And in Tobago, unfortunately, they have said that if anyone gets it that needs hospital care, that they would have to, well, I understand they said that they are going to send them on a Coast Guard boat to Trinidad, to Cora or Couva. We don't want a situation where we have to be sending granny on a Coast Guard boat to Cora or Couva. So please, if you are home because you just came off of one of those flights, or you've been in Tobago for the last week because you've just come off of one of those flights that were coming in, please do us all a favor, all of us, and self-isolate properly. What does that mean? Stay in a well-ventilated room. We want opportunities for fresh air to come in and old air to go out, right? So it is not ideal to be cooped up in a home or in a room that has AC and everything is locked down. Because remember, if everything is locked down, it means that if you are there, everything you have is there in the room locked down with you. Having fresh air circulating and so forth is a good thing in a situation like that. So you need to be in a space that is well ventilated, that you have fresh air coming in and so on. You also, as I said before, you need to be staying away from other people in the home. Stay away from other people in the home because you don't want to infect them. Even though you are staying home, they may be going out because they have to. So you don't want to infect them and then have them go out and infect others. For the life of all that is holy, if you are self-isolating, please stay home. Please, oh God, please stay home. I know it is going to be tough. I know psychologically it's going to be difficult, but you need to stay home. You need to stay in that one room. You need to consider it as taking the 2 weeks to recalibrate your head, to think about all of the things that you have been wanting to do, to get all of your assignments that have been due, you know, the business that you wanted to start. Take the time, take the 2 weeks to bunker down and put all of those plans in place so that when we get out of this, you are ready to go, you're ready to go, you're ready to go. And that applies to this whole social distancing thing too, where we are telling everybody, unless you absolutely need to go out into the world, stay home. Stay home. Because the reality is, I shared a little clip this morning on Facebook. It's kind of funny, but it really highlights why this is important. It was highlighting somebody who just sneezed on a train because they did not cover their cough or cover their sneeze properly. The droplets were on a handle, the bar that we hold on to. Somebody else then comes and holds onto the bar, so of course the virus is now on their hand. That person had a child. The child was about to do something, so the mother then touched the child's mouth or something, which means the thing is now all over the child, and then the child sneezes, so a fourth person is now infected because the child sneezes, just because they didn't stay home. You see, if the person had stayed home, then they would not have been in contact with the child, who was in contact with the mother, who was in contact with the pole that the first person sneezed on. This is why it is so important. Now, if everyone stays home, if everyone bunkers down, if everyone does what we are asking you to do, which is to remain that keep your social distance from other people, if everyone does that, it means that the people who have the virus inside of them, they will not pass it on to others. Now, the virus would go its normal course, meaning if you get sick, if you are one of those people who get sick, you may get mildly ill and you have the cough, you have a slight fever, you have you know, you may feel a little bit of shortness of breath, whatever, but because you are very mild, you may not have to go into the hospital and to get treated in a hospital. When you recover, meaning the virus has gone its normal course and you recover from those signs and symptoms, we are hoping that this virus would act like others, where you would then develop some level of immunity to the virus, which in essence is what vaccines do, immunization is. So because you've already contracted it, because your body has gone through the process of fighting it, then you would now become immune to it. That is what normally happens, and we are hoping that that is what happens with this virus. We don't know yet because enough time has not passed for us to say definitively that is going to happen. But we are hoping that that is what is going to happen. So it means that there will be a bunch of people who have developed some level of immunity to the virus, which will be good. Because it means that if the virus comes around again, because you have already developed an immunity to the virus, you would not get sick because your body already knows how to respond to the virus, which is what we want, which is good. So the next time it comes around, and it will come around again, that's how viruses are, that's how this thing works, at least you would be protected in some way. Which is why when an actual vaccine for this virus comes around, which may be another year and a half, because that is the time it takes to get these things onto the market, it is important for everyone, particularly if you did not get COVID-19 this go around, it's important for you to take the vaccine so that your body is prepared for when it comes around again. Okay? Your body is prepared for when it comes around again. So several people had asked questions. Let me make sure that I have answered those questions thus far. Let me go through and ensure that I answer those questions. If you have other questions, you can type them in the chat in the live, and I will go through those questions at the end, but let me just make sure I have everybody's question. I've answered everybody's question. So somebody had asked me about psychological support for people who are treating with this, because the reality is, if you are okay, so if you're like me, I am an introvert by nature. I am a loner. I am an only child. I love being by myself. So for me, this isn't an issue. As a matter of fact, I am loving this social distancing. I am loving it. For other people though, it is not this easy. For other people who are extroverts, for people who are used to being out and about and liming and that kind of thing, this might actually be pretty difficult for them. And it's a reality. So for those of us who are comfortable in ourselves or comfortable being by ourselves, we have to be conscious of the fact that there are going to be people out there who are really having a hard time with this, and we need to also be able to reach out with them. So we need to start making phone calls. Hey, you okay? I know we normally lime every weekend, but we can't do that. Let's have let's form a Facebook group and have a Facebook Live, or let's use our WhatsApp chat and have a WhatsApp video conference. Let's, let us all do this. I am seeing, for example, gyms are saying, because we are saying, depending on the size of your gym, don't go to the gym, because it's hard to socially distance yourself from the gym, in the gym, and all of the equipment and so forth. If people keep touching it and that kind of thing, then it's hard to do social distancing in the gym. I have seen gyms then sending messages to their members. Okay, saying, the challenge for today is, let's see who could do the most push-ups, and do the push-ups, tape it and send it in. So even though you are not exercising at the gym, you still feel like you are still part of this community. And I have been seeing the videos of people, doing the 10 push-ups or doing the 20 push-ups or whatever, and posting it. And that is also motivating other people to go and try to do their push-ups and that kind of thing. So we have to be conscious that you need to figure out innovative ways of still interacting with people without physically being close to them. And that's one way, for example, of calling around people. Personally, I do think that our social support system, our social, like our counselors and those people, I don't know if they're doing it, but ideally I think that they should be, calling their clients saying, hey, how are you going? I know this may be a difficult time for you. Maybe we could have a session on the phone, a counseling session on the phone, instead of coming in the way we normally come in, and so forth. So, we have to find different ways of treating with this psychosocial part of it, because it is going to take some time. It is going to take some effort. Some of us may actually do need actual counseling to treat with situations. I know, for example, of people who, because we've now cut off our borders, and because since last week we stopped non-nationals from coming in, people who are non-nationals who work in Trinidad and Tobago, who happen to leave Trinidad and Tobago for whatever reason the week before, and are now stuck outside of Trinidad and Tobago and are not home, as in where they are originally from. And it's difficult. It's difficult. So we need to then be very, very conscious of the fact that people would need help. People would need psychosocial support, and we have to ensure that we are a listening ear. We are a listening ear. When you get the call, when you get the message saying, can you talk, from a friend, it might be 10 o'clock in the night and you really, really want to go to sleep, but that friend may really, really, really need you to be a listening ear at 10 o'clock in the night. And that is what we need. That is what we need to do. We need to really, really reach out and be our neighbors, our brothers, our sisters keeper. Let me go back to another set of questions that I have here. Again, if you have, so okay, another thing, If you are self-isolating, so if you're isolating in a state-sponsored institution, then part of that isolation, quarantine. If you are quarantining in a state-sponsored institution, then part of that process should be medical professionals coming every day to check on you, to check your temperature, to check to see if you to make sure you don't have any signs and symptoms. If you are at home though, they may not be coming. I understand that they are calling you every so often to check up on you. How are you feeling? Do you have a cough? Do you have a temperature? Do you have a fever? Do you have any shortness of breath? Because those are really the key things for COVID-19. If you recognize that you have those symptoms, then we've always said from the beginning that you should not be rushing to go to the doctor or to go into a health facility, because if you have COVID-19 and you go sit down in A&E with everybody else, it means you can then infect everybody else, right? So that is not what you should be doing. We have posted the telephone numbers for all of the health centers in Tobago, the hospital, and I am not 100% sure if the 211 call center has been up yet, because I know that the plan was to have part of 211. We know in Tobago you have 211. You can call 211 to get the ambulance, police for emergencies. You could call 211 to get a telephone number for somewhere, and they were also adding to call 211 if you are feeling like you have any of these signs and symptoms, to actually talk to a doctor, or maybe it was a nurse, for them to basically triage you over the phone and then tell you what to do. I'm not sure if that is up just yet, but that is an option. Definitely call the health centers, call the hospital. Don't go in. Call them, have them chat with you, tell them your signs and symptoms, so that they can then advise you based on your signs and symptoms whether you are if you, again, because this is normal cold and flu seasons, we would have quite a bit of people who have normal cold and flu. You may have a runny nose and sneezing and that kind of stuff, and that is where they could help you determine whether your cold or flu symptoms are actually the cold and flu symptoms that relate to COVID-19. So you need a health professional to tell you that, and you should call those numbers. Again, even if you have to be outside for whatever reason, your job is saying that you need to be there because you are a first responder. Actually, you know what? I have been hearing that there are some people telling their workers, their THA workers, for example, that is a normal 8 to 4, they have to come to work 8 to 4. And I'm thinking, please don't. Unless you are doing something that is absolutely necessary right now, you don't have to be at the job, physically at the job. You can work from home. If what you're doing is clerical stuff where you're writing letters or whatever, you can do that from home, sending the letters from your laptop to the office, have them printed there, so you only have maybe one person in the office who are collecting those things. As a matter of fact, why we printing letters anyway in this day and age when we have email? Okay, but just in case you have to, you can do that from home. If you are one of those people though who need to go out, meaning you are part of the essential services, you work in the hospital. If you work in the hospital, if you are a doctor or nurse, then hey, while everybody else rocking back home, you kind of need to keep going to work. And we are thanking our health professionals who are really, really overburdened by this. They have to go to work. The protocols in the hospital and so forth are very different, and they need to do it. But if you are somewhere else, let's say you have to go out and get groceries because we need to eat. You have to go out and get medication because you need to keep taking your medication. Ensure that you still practice the social distancing in those instances. When you're in the drugstore, ensure that you are, if you look through the door and you realize that that drugstore has 10-15 people inside there, find another drugstore or wait outside until they are done. if you are waiting outside, because I have noticed this, where you see the drugstores and the groceries and so forth limiting the number of people inside, but there are a million people bunched out outside by the door, that is not social distancing, because as you are bunched up outside, imagine you right in front of the door, 10 other people and one all your sneeze. What's going on there? So that is not social distancing. So you need to be careful. You need to critically think about this whenever you are out in public, to ensure that you are at least I would say 6. At least 3 is the minimum, 3 feet. Go to at least 6 if you can, away from other people who are out there. And that goes to people who like to exercise outdoors, because you may be the kind of person who is running. You may be the kind of person who likes to swim, to go in the beach. You may be the kind of person who likes to do those things. Even if you are doing those things, because our rules in Trinidad and Tobago have not banned those kinds of activities yet, ensure that you are keeping a safe distance away from other people who may be doing those things. So if you're running by yourself, or even if you're running in a group, the group is so widely spaced out that you are keeping that distance from each other. That is absolutely critical. Okay, so let me answer some of the questions that I see on the live. Let me go back to the beginning to make sure. Somebody asked, how am I handling it? I am handling it pretty well. I am self social distancing, because, okay, so let me explain the difference. So remember, we talk about isolation being for those who are sick, quarantining being for those who have been exposed but they are not sick. So we are giving you enough time to make sure that you are not sick before we let you out into the general public. For the rest of us who have not been exposed at all, we practice social distancing, and social distance is ensuring that you stay physically away from other people, just in case any of those other people are sick, and they may not even know that they are sick just yet, because for whatever reason, it may be some very rebellious person who just came off of one of those planes, and instead of staying home, they're going outside. Instead of staying home, they out in the grocery with everybody else. And because you don't know that that person just came off of a flight, you don't know that that person may have the virus. So you need to socially distance yourself from everybody, just in case that person is one of the rebellious ones who came off of a flight and is not following the directions that they should. By the way, we have rules in Trinidad and Tobago about quarantining people. One of the reasons they let you sign the contract is so that you understand that if they recognize that you are not following the rules, you can be charged. You can be, if you keep not following the rules, they can physically detain you. So you need to be following the rules. You need to be following these rules. So let me go through the questions again. Thanks for the compliment on the hair and my v-neck. This is actually one of the, this is a jersey that I got from C2C Marathon. I can't remember if I actually did the 5K or 10K in this one, but this is one of them. Let's see here, I'm going through. This should be aired live. Okay, thank you. Yes, negative pressure rooms. Let me go back. So people are asking about the isolation and the isolation rooms, negative pressure rooms, and whether Tobago has the facilities. That's a question that I have unofficial answers, and my unofficial answers is that technically, when you really think about isolation in the greatest sense of the word, in the truest sense of the word, we really don't have isolation rooms in Tobago, and we particularly don't have ICUs. Now let me tell you why ICUs are critical. An ICU, intensive care units, beds within ICUs are beds that are hooked up to ventilators. Ventilators are, in essence, things that help machines that help people breathe. Because remember, the virus gets into your lungs, and when it gets into your lungs, it actually causes your immune system to start responding to get rid of it. The reason why some of us respond so badly is that the immune system actually starts forcing our bodies to fight off the virus, but the response is so strong that it actually starts causing our bodies to start fighting against healthy cells and good cells. So it starts damaging your lungs, damaging your entire breathing system. And those people then need to be on ventilators to help them breathe. And that is why I understand that our patients in Tobago would actually be taken to Trinidad, because I don't know officially how many ventilators we have in Tobago. And I don't know officially, and I'm saying officially for a reason, that I don't know that we have that kind of capability in Tobago, just in case something were to really happen and we needed to ventilate 10 people, for example. I don't think that we have the capacity to do that, which is why we need to send our patients in Tobago to Trinidad, which is why I keep telling people, because we have limited capacity in Tobago within our healthcare system, we need to do everything in our power to ensure that we don't get sick. We need to do everything to ensure we don't get sick. That's absolutely necessary. Okay, let me see this question. Doctor, it says, I don't know how you can change people's mindset right now. I have a salon and spa, and people cancel their appointments because they are scared to congregate, which is good. Because again, they don't know if you have the virus. They don't know if other people have the virus. They're not sure if the all of the equipment, the bed, the chair, everything has been cleaned. So the safest thing really is to cancel all of those things right now. They are not essential. They are not essential services. They are not, so anything that's not essential, you need to cancel. Too many cases at one time would be the issue. Other countries can't handle the number. Right, so yes, that's critical, excuse me. And let me give you an example of why we need to do the social isolating and ensure that we don't get large numbers of cases. Yes, even though most people, over 80% of the people who have COVID-19 do not get severe symptoms. They don't need to be hospitalized. Because of how infectious COVID-19 is, it means that the more people who get sick, even though the people who get severe illness is small, if we have a large number of people who get sick, it means we would have a large number of people who get severe illness and need to be hospitalized. So if we have 10 people in Tobago, for example, with COVID-19, of the 10, 1 or 2 may actually need to be hospitalized, which may not be a problem. But because of how infectious it is and because of how quickly people can transmit the disease from one person to the other, if we have 10 people and those 10 people did not bunker down and did not isolate themselves properly, those 10 people can then infect, each person infects on average 3 people, and then those 3 people each infect 3 people, and then those 3 people each infect 3 people. We could see where within a short space of time we go from having 10 to now have 1,000 people who are infected. That's a very real possibility. And let's think about this, Tobago. If we have, so yes, if it's only 10, maybe only 2 of those people would need to be hospitalized. If we have 1,000 people who are sick though, then it means we now have 200 people who may need to be hospitalized. 200 people. Tobago, our brand spanking, 6-7-year-old hospital is a 100-bed hospital. So let's just think about that. We could very quickly go from having 0 cases or 10 cases to having 1,000 cases, and of those 1,000 cases, at least 200 of those may need to be hospitalized. 200. We only have a 100-bed hospital. So that is why you have to take all the precautions right now to make sure you bunker down, to make sure you keep your butt home, to make sure you do not put anybody else at risk, particularly those of you who just came off of planes coming from wherever you come from. Please do not take this self-quarantining thing as a joke. Please, this island is begging you to be responsible. All of us need to be responsible, because if we are not responsible, we can crash our healthcare system, and our system is already not the best. It's not the worst in the world, but it is certainly not the best, and we can't do that. I'm seeing there are persons right now who are in state-sponsored quarantine facilities without proper sanitation and precautions taking place by nurses and officials, and I hope to God that that is not true, Sanisha. Because if that is true, then that is a recipe for disaster. That is a recipe for disaster. And of course, if that is the case, people are scared of contracting it in the facility, which so in these facilities, you have to be cleaning like there is no tomorrow. Continually cleaning. People have to keep separate. Sanisha, I'm going to have to look into that, because if that is really the case, I shudder to even think that might actually be happening. It is very difficult to self-quarantine when living with others. Yes, it is easier said than done, but it's something that we have to do. It's not easy at all. This entire process is not easy, but we have to do it. We have to do it. Does self-isolation within the home apply to individuals who don't travel abroad as well? Yes. Okay, so remember, if you are saying isolation, it means the person is sick. If the person is sick, what we've been telling, that's why we've been telling sick people. So even if you don't know that you have COVID-19 at all, but you have cold and flu symptoms, you need to self-isolate at home, because we're not sure if what you have is COVID-19 or not. And that's why we're saying you stay home, don't go to work, call the health centers and the hospital, let them know what your symptoms are, and then let them advise you on the next steps. The next steps may be for them to come get you, to come and get tested or whatever. Let them advise you. But once you know that you are not 100%, once you know that you have cold and flu symptoms, you need to self-isolate at home. Yes, even if you have not traveled abroad, because you may have actually come in contact within the last week with somebody who did travel abroad, and you don't know that. So that is the key thing, because that person may have not been self-quarantining as they should, and they were in the grocery with you. So that's why even if you did not travel abroad, you need to still self-isolate at home if you are sick. Let's see here. Based on the history of virus progression, it is better for closed, restricted Tobago borders now with no known cases, or should we wait until the country? Okay, so the question about whether we should close the borders of Tobago is something that comes up continually. One, technically, and this is just purely from a legal standpoint, the Tobago House of Assembly right now does not have the authority to close the borders between Trinidad and Tobago. So that is a reality, which goes to the whole idea of Tobago's independence to Trinidad and giving the THA the kind of authority that is necessary for us to really manage our affairs here in Tobago. Because if Tobago was really in a position to completely separate itself from Trinidad, that could have been a decision that the THA could take. Because, for example, I understand that we are waiting for some of our PPEs to come from Trinidad. We should have been able to get our PPEs from wherever everybody else getting their PPEs from and getting it directly in Tobago. We should not have to be waiting to get it from Trinidad. And because we have those kinds of issues, it is going to be very difficult to actually just close the border between Trinidad and Tobago. But that is something I'm glad you raised that, because it really, really highlights how much Tobago really needs to rethink how dependent we are on Trinidad, and we need to put our house in order. Because if we are in a situation where, for example, Trinidad gets swamped, if the situation in Trinidad gets out of order, we cannot say that we are sending our patients to Trinidad, because Trinidad may not even be able to deal with their patients in Trinidad. So we really, this is an opportunity for Tobago to see how dependent we are on Trinidad. And when we survive this, when we come out of this, ensure that we are never placed in a situation like this again, where we have to be absolutely so dependent on Trinidad for everything. Let's see, let me go through again to see if there are additional questions. So somebody said, I thought that the border was closed. So what we've done, and let me just say that what we've done in terms of closing our borders, Trinidad and Tobago has closed our borders. Last week, we closed our borders from having international people come in. So if you were not a citizen of Trinidad and Tobago or a legal resident of Trinidad and Tobago, you could not have gotten onto a flight to come into Trinidad and Tobago. Before that, we had stopped flights that were coming from, China and those places that had very high cases. Last week, we stopped people who are not Trinbagonians from coming in. From this week, last night, midnight, we have stopped all international flights whatsoever. Whether you are from Trinidad and Tobago or not, no flights are coming in or leaving. I understand though that we have had some, the UK and somebody else, I can't remember which country, have asked for permission to send a plane to pick up some of their citizens who were stranded here. And I understand that the Minister of National Security and whoever else granted that permission for them to come. So there are a few planes that may come today or tomorrow just to pick up some, I think, people from UK or whoever. But other than that, all of the flights coming in and out of Trinidad and Tobago have been stopped. There is still transportation, or there's still movement between Trinidad and Tobago. So Caribbean Airlines, for example, is still running planes between Trinidad and Tobago. The inter-island ferry still running, the Cabo Star and the Tobago, the Trinidad Express or whatever the boats are. But they have actually put provisions in place to allow for social distancing in the plane and in the boat. If you are on one of these islands and you absolutely don't need to get to another one of these islands, stay your butt home. Don't get on a plane, don't get on a boat unless it is absolutely necessary. But so far there is still movement between Trinidad and Tobago. Going through some of the questions. So somebody said at the facility in Tobago, they told them that they haven't sorted out any sanitizing products for them. They haven't sorted washing of clothes schedules. They allow them to go into the rooms with all of their suitcases and bags from crossing all of the borders. And they told them that it is okay for them to not wear the mask on the compound. Well, the nurses who took their vitals this morning were not even wearing masks. Okay. 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 That is why Tobago, that is why you all need to stay home. And you all need to bunker down, and you all need to Sanisha, that can't be correct. That can't be correct. That cannot be correct. This is ridiculous. That can't be correct. Anyway, when I get off of the live, I will go and start making some calls and start to figure out what's going on, because no. we can't, no, that can't be correct. Okay, so any other questions? Any other questions about what we need to do? Any other questions about if you are, particularly if you are one of those people who came off of a plane and you're self quarantining at home and you have questions, let me know. If you have concerns, let me know. I will try my best to answer them, and we will go from there. Each of us, we have to take full responsibility. We have to behave like adults. This is a situation where we have to behave like adults. We have to, it's uncomfortable. Yes, it is uncomfortable. For some people, it is very uncomfortable, but it is something that we need to do now, because if we do this now, we could save ourselves a lot of heartache, a lot of deaths. We could save ourselves a lot of undue hardship in the future. This is one of those where you need to think about it as delayed gratification. We bunker down for 2, 3, 4 weeks, we nip this in the bud, and then we can continue doing what we need to do after, because it is critical. All right. I am in the Bahamas, so do you know if there would be flights out, being as I would be connecting in Jamaica first before Trinidad? Matty, there are no flights coming to Trinidad and Tobago. None. There are no flights. If you are in the Bahamas, then for now you need to stay in the Bahamas if you can. If you are going to Jamaica, I don't know if that's an option if they are family members or whatever, but for now the Minister of Foreign Affairs, of National Security in Trinidad and Tobago, and the Prime Minister have made it clear that after last night at midnight there are going to be no international flights coming into Trinidad and Tobago. So if you are not in Trinidad and Tobago now, you kind of just need to stay where you are right now and stay inside, bunker down inside, and do what you need to where you are. Right? Any other questions? If there are no other questions, again, remember, wash your hands, 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 wash your damn hands, because when you use soap and water, quick thing, the virus has a kind of a coating that protects it, right? The virus has a kind of coating that protects it. Soap washes away that coating. Soap washes away that coating. And when that coating washes away, the virus dies. Okay? So that is why you need to wash your hands with soap and water, because it is washing away the coating of the virus. And when the coating of the virus washes away, the virus cannot survive. The virus dies. And then you use the water to wash the dead virus down the drain. That is why soap and water, even though it seems to be a very simple solution, it is the solution. So keep washing your hands, because you may have just touched something that someone just coughed on, or somebody who coughed into their hands just touched, and because you now go and touch it, you now have it on your hands. Soap and water. Soap and water. Private jets should not be landing in Piaco or landing in anywhere. So why am I seeing a report that the Ministry of National Security authorized entry for those stranded in Suriname? That may be the case. The same way they have allowed a flight or so to come to Trinidad and Tobago to pick up the UK residents. They may have actually done some kind of negotiating with Suriname to go and have maybe Caribbean Airlines pick up our people from there to bring them back. I have not seen that report, Gerard, so I can't confirm, but if that is the case, then I guess that is what they did. How to estimate 3 feet in public? Wood and arm's length work? No, you need actually more than an arm's length. You need at least. So how do we, ideally, If you are putting out both arms out, that is the distance from one fingertip to the other. Stretch your hands out, one fingertip to the other. Be at least that distant away from people. At least. So not one arm's length, but 2 arms lengths away from people is how far you need to be. If you can touch them, if you can physically touch them, then you are too close. You are certainly too close. If you can physically touch the other person, you are too close. All right, so any other questions? Let me again make sure I don't have, I didn't miss anything. So if there are no other questions, I think I would end the live now. If you have any other questions, you can message me, private message me, or you can post it on my Facebook page or whatever. You can do any of those things if there are any other questions. I would do other lives as more things come up. I would do other Facebook lives so that you could have the information. Definitely share the information. Yes, in Canada, 6 feet apart, that is ideal. 6 feet is ideal. At least 6 feet is ideal. So if that's it, I hope this information was useful. Definitely share it with as many people as possible. If you are in self-quarantining, please take it seriously. If you are sick, self-isolate. If you are sick, self-isolate and call the numbers, call the health centers or hospital so that they could give you advice on what to do. They may or may not test you for COVID-19 depending on your signs and symptoms, depending on your other issues. They may not test you, but that is why you need to call so that that information is there and they can direct you. All right, so remember, wash your hand, socially distance yourself from everyone. Stay home if you are sick. If you are one of those who are under quarantine, then if you are quarantining in the state-sponsored facility, ensure that you stay separate even within those state-sponsored facilities. If you are quarantining at home, ensure you stay separate even in your house from other people. If you have elderly people in the home, if you could find a way to have them stay somewhere else, particularly if you are self-quarantining or self-isolating, keep them away. If not, then you try your best to stay separate. Even in your own home, you need to stay separate. All right, so guys, we can do this. We can do this if all of us bunker down, if all of us take this seriously, if all of us do our part. We could come out of this better. We could come out of this greater. We could come out of this stronger. We could come out of this with renewed strength. We can do this, guys. So have a good day. Have a blessed day. Enjoy. And do something nice. Do something that you've always wanted to do. Take a little time to introspect. Think about your life. Think about what you can do better. Think about where you can go. Think about what you can do. Think about how you can develop the business. Think about all, this is an opportunity to think about all of those things that you had not had time to think about because you've been so busy going around and so forth. So anyway, see ya. Thank you. Share the live so that others can benefit. See ya.